3 years ago, this gentleman was training for the Oklahoma City Marathon. Unfortunately, he suffered an inversion ankle sprain after jumping off the back of his pickup truck and tripping over a pneumatic air tool. He presented today with swelling still 3 years later over the lateral malleolus and difficulty in running, walking, and exercising.
Relax both feet for me. I'm going to push them forward. Okay. So, Toby, you do have some limitation in your left ankle rocker. So as I push this forward, the big toe on the left side doesn't go as far forward as the right. You can try to look up here if you want to and see that difference. Can you see how that one's closer to me and that one's closer to you? Right? Yeah. So when you roll this ankle in that direction, that inversion sprain, this talus bone here, it rolls forward towards me. Okay? And that robs you of that ankle rocker position. Yeah. So we'll want to get that back, especially as you have a goal of getting back into running. When that is your trail leg, you want to be able to extend that. The next thing we're going to look at is the joints that connect to the talus here. So if you keep that soft for me, we're going to check the motion. Is it tender at all in there?
No.
Okay. How about right in there?
Very little.
Let's compare that to that one.
About the same.
About the same, okay. We're going to go into this one. And that mechanics looks pretty good. Works pretty good. Okay, we're going to compare that to this one. Have you started running yet?
No.
Okay.
I bike. I cycle.
You do? Cool.
That's about it.
Road bike?
Yes.
Clip in?
Yes.
Okay. Okay, good. So everything moves really pretty good in this foot, of course.
Yeah.
This one has some limitation, but it's mainly located just in the talus joint, okay? So I'll show you what that is. That's the talus. It's this large bone here. It provides the action of the foot like this called dorsiflexion. So you're a little limited on that left foot as it goes up. The unique thing about this bone is there's no muscle attached to it.
It's all ligaments?
It's all ligaments. So when you have an ankle sprain like that, you're going to typically tear the anterior talofibular ligament and sometimes the back too, but typically the front one is the most common that's injured. And that leaves this guy here relatively down and forward like I was kind of showing you. So the way we do that is we just correct it, is just we lift it up and pull it back in under the joint. It's really quite simple, the maneuver. But the swelling that's here on the outside is indicative of the fibula, the little bone on the outside, isn't gliding and moving. So we're now going to check the top part of that here. And we'll compare the right side to the left side. So this one moves quite well. So as you dorsiflex the foot, that fibula comes up and touches my hand. And as we dorsiflex this one, the movement's a little limited. Not a ton, but a little. I think I can help you.
Cool.
I would take a picture of the foot so we can see what the alignment is of those joints.
Right.
And then today we'll do an adjustment on that. We'll go back and check the range of motion, see how it feels, and see if you can get some, feel some improvement in terms of your gait as you walk out today. And I'll try to set some expectations for you. Usually these kinds of things are going to respond in about 3 or 4 visits. They're going to feel some improvement, and hopefully today, it'll feel a little bit better. I'd like to get that swelling out of that, and again, I think that's because of this is misaligned secondary to that inversion sprain. It's a known thing. It's documented. I've seen these go away.
Stays that long ago?
Yes. Yeah. I've seen these several years old, in fact, and after a couple of visits, I've seen the swelling go away in about 72 hours post adjustment. I don't want to promise that because I suppose that it wouldn't happen. But the handful of times I've seen this residual swelling after an ankle sprain, it goes away after a couple of adjustments, usually after about 3 days, after a good set, a good correction of the ankle. The most important thing outside of that puffiness is the function, right? So you want that to extend back, so that's your trail leg and you're running, your mechanics are solid, so you're not jacking up your knee and your hip and your back, right?
Exactly.
Or further injuring this thing. I'd like to check your balance. If you would stand up for me. All right, let's go take a picture. So there's, of course, your side view or lateral view, and that's what this position is of the foot. And as that talus bone, this one here, rolls forward with an ankle sprain and then inverts, it creates a gap and a space
Wider.
right there. And that's why it's wider in that section than it is on that one.
Okay.
Okay, and it starts to create some misalignment here between these two joints. As this goes like that, then it starts to gap down in there too. Okay, so this is the outside bone, and that's where all that puffy swelling is. So some of that swelling is from the fibula being misaligned, yep. And some of it's from that guy opening up as well. So we have kind of three things to do. We need to take this bone and decompress it, and this is a really simple move, and it just puts it back into place right there. You can see how that closes down, right? And that's actually quite comfortable. A lot of these are. And then this one, we're gonna move this joint as you lay down just forward a little bit like that. We're gonna go up to the top part of it and take a look at that again because that was stuck, right? And then this last one is just taking that joint, then remember it's gapped a little bit here, so we're gonna close it down like that.
Wow.
That's the action. So there's three specific things we need to do to kind of close down that space. And there's some other things we can look at on the x-ray to kind of compare the left and the right side, but I think that that's probably enough of an explanation for you.
Yes.
Okay, any questions about anything we've covered so far? Okay,
No
I'm excited to see you. I'm excited that you want to get back into running, and I think you'll be able to reach that goal. To make the correction of this ankle, I want you to roll to your tummy now. Okay, you're gonna bend this knee. And then relax that foot for me. We're gonna decompress that. Good. There we go. Nicely done. So it's a really good correction. How was that?
It was good.
It was good, right?
That's it.
A little bit of a giggle, so I take that to be a good sign. Okay, so that was massive. I mean, that's exactly what you needed 3 years ago. So let's fix the other two pieces to this puzzle. Now have you lie on your back with your head there. On your back, please.
That's too funny.
Isn't that funny? Yeah, so I do think that puffiness, that swelling will go down, but give it about 3 days, like I said. Okay. Okay, I want you to soften this one. There we go. So that was that calcaneus or heel bone we talked about. And yeah, that actually moves so much better now at that fibula than it did earlier. All from fixing
That first one.
that first one, that talus, and now that calcaneus. So let's take a few steps on that and see how that feels. And we can use the hallway if we need to.
It's a lot better.
A lot better. Okay,
I
cool.
mean, yeah, there's. Yeah, I mean, even before, if I looked it up, I could feel it now. It just feels normal.
Yeah, good. So I don't think I'll have to see you a million times, man, but probably 3 or 4 to really kind of retrain it. Then I'll give you the home care and the exercises, kind of teach you how to fish, right?
Yeah.
Instead of feeding you, teach you how to take care of yourself. And,
Yeah, that did it.
Yeah.
Wow.
Awesome, man. Nice to meet you.
Thank you.
I think you'll notice that swelling is already less.
I was looking at it.
Were you looking at that? Yeah. I'll have to go back and play the video and see, but I think that swelling is already less. So what I'm going to do is kind of shorten the foot with some tape.
Okay.
And it's the best thing we got to kind of retain that talus in that position because as I mentioned earlier, there's no muscle attached to it. So we really need to train your brain to say, hey,
Keep it there.
let's keep it there. That's right.